আমি হচ্ছে প্রফেসর মোহাম্মদ মইনুদ্দিন চিস্তি, Professor of Pathology of your medical college. Today I am going to take the review class of hematopoietic and lymphoreticular systems. So, in these systems you must know the hematopoiesis, cell review and leukemia. And in leukemia, you must know the acute leukemia, chronic leukemia and myeloproliferative disorders. And lymphoma, mainly the non-Hodgkin's lymphoma and Hodgkin's lymphoma. Sometimes the examiner asks you the questions, which lymphoma is a benign? To give you to mislead you, your answer should be lymphoma is always malignant, so no benign counterparts. Clear? And then we ask the plasma cell disorders and Langerhans cell histocytosis. And mostly you will ask the multiple myeloma. It is very common, and if you do not answer these questions, multiple myeloma especially, what is multiple myeloma, how you will diagnose the case of multiple myeloma and what is the future, then you will be problem in the past. And then the most basic things you will be asked, what is the leukocytosis? If you do not answer the leukocytosis, then your future will be the next 6 months after. If you cannot say what is leukopenia, then you will be the same futures. And if you do not answer the infectious mononucleosis, then no minds. And if you can answer, then you will get the good marks. The next হচ্ছে যে what is leukemia? So, grossly, leukemia is a malignant disorder of blood cells and marrow, and symptoms based on the cytopenias. And lymphoma, if the mass forming malignancy, often in the lymph nodes. And nowadays leukemia and lymphoma at the same time used, because leukemia may become lymphoma when lymph nodes are seeded. তাহলে এখন আমরা যদি জিজ্ঞাসা করি যে what is leukemia, তাহলে your answer should be a malignant neoplasm of hematopoietic stem cells. One part, one condition, and then the condition is infiltrate bone marrow and other organs. Second condition, and third condition হচ্ছে reflects in the peripheral bloods. So, if you can say, one, it is a malignant neoplasm of hematopoietic stem cells. Second, it infiltrates the bone marrow and other organs, and lastly third number is the reflect in the peripheral bloods. So, we can diagnose a case of leukemia by seeing a CBC, complete peripheral blood pictures. The word leukemia comes from the white blood cells earlier, because it was thought that neoplastic proliferation of white cell disorder. But nowadays established that leukemia includes all cells lineage derived from hematopoietic stem cells, and it is a very important case because leukemia accounts for about 33% cancer in the children under age of 14. Now usually we ask what are the causes of leukemia. Previously you already know what are the causes of neoplasms. So, similarly the neoplasm is a tumor, you know already, and causes of leukemia, the inherited cause, the patients having Down syndrome, Fanconi syndromes or Klinefelter syndromes have increased incidence of chronic, that is leukemia. So, inherited cause. Then genetic cause, if there is a mutation, especially the point mutation of proton gene, amplification of genes or translocation of chromosome materials, as for example 9 and 22 in case of Philadelphia chromosome. This already you know. So, the other factors is the major factor is environmental factors. The chemical causes the carcinogenesis, you already know, as for example benzenes, chronic exposure to benzenes lead to the leukemia. Drugs, that is other causes of leukemia, the treatment is drugs giving the anti-cancer therapy, then second neoplastic transformation is occurs causing the leukemia. Radiation to the marrow is already you know that it is a leukogenic, and viruses which causes leukemia HTLV1. It also you know from the neoplastic malignant transformation, the lots of viruses are involved. Then you will ask what are the types of leukemia? You must say that it is acute leukemia, chronic leukemia. So, acute leukemia again it is divided into acute myeloblastic leukemia and acute lymphoblastic leukemia. So, chronic leukemia again it is divided into chronic myeloid leukemia. In other terms we also use the chronic granulocytic leukemia and chronic lymphocytic leukemia. AML, that is acute myeloblastic leukemia, causing about 80% of the leukemia under the age of 14. So, it may occurs AML, it may occurs at any age, but commonly occurs between 15 to 40 years of age, and it is more frequently in case of female than in case of male than female. So, what will be the clinical presentations in acute leukemia? So, in acute leukemia there is a anemia. So, the features of fatigue, weakness, and there will be the infections, and in acute leukemia there is a platelet deficiency, so bleeding disorders, and due to organ infiltration there will be the another symptoms, pain and tenderness if the leukemic cell infiltrate in the bone and joints, lymphadenopathy in case of especially more common in case of ALL, and splenomegaly and hepatomegaly, and upper respiratory tract infection is very common especially in the children's. Gum hypertrophy due to leukemic infiltrations in the gingiva, and meningeal irritations involvement resulting headache, vomiting, papilledema and irritability, especially in acute leukemia, that is ALL. Now, your questions will be how you will diagnose this case of AML, acute myeloblastic leukemia. So, the most common and simple is the CBC, complete blood pictures. What happened? Here the hemoglobin will be decreased, RBC count will be decreased. In the meantime, you already know why RBC is decreased and why platelet count is decreased. That is, the RBC, the precursor cells and platelet precursor cells in the bone marrow is there is no scope to proliferate, because in AML myeloblast flooded the bone marrow. So, other cells are less possibility to proliferate. Now, the peripheral blood pictures, RBC, there will be normocytic, normochromic, sometimes nucleated red cells may be seen in the peripheral bloods. So, the diagnostic criteria depends upon the WBC series, WBC immature cells are present. Immature cells are mostly in AML the blast cells. So, we usually write the WBC should shift to the left and predominant cells are the myeloblasts. So, the bone marrow aspirate, what we will find? The cellularity will be the hyper, myeloid erythrocyte may be the increased, erythropoiesis that is decreased, leukopoiesis increased, and mostly the bone marrow is flooded with the blast cells. Megakaryopoiesis is also decreased. What are the special stain? If this is very easy most of the cases, but sometimes the diagnosis is not so easy. So, whether it is a AML or ALL, so we need sometimes the special stain. What type of special stain? Myeloperoxidase. It is positive in case of AML, acute myeloblastic leukemia, but negative in case of acute lymphoblastic leukemia. PAS, per-iodic acid is chip test, negative in acute myeloblastic leukemia, but positive in lymphoblastic leukemia. So, it may also use the flow cytometry and cytogenetics PCR, but we usually do in our country the lumbar puncture for CSF involvement, especially in acute leukemia, and it is advisable in all patients with ALL, but in case of acute myeloblastic leukemia is indicated with neurological symptoms. তারপর এখন আসা যাক আমরা acute lymphoblastic leukemia. It is caused by a defect in the stem cell that differentiate into lymphocytes, preventing development of other cell types. The cells of origin is the precursor of maybe the B cells and it accounts for the 75% and T cells in 25%. In most common type of childhood leukemia is 80% and peak between 2 to 5 years and rare after 15 years. In case of Down syndrome, the risk of development of acute lymphoblastic leukemia is increased and 5 years survival is 95%, 90%, but if the age is more than 40, then the survival is only 40%. Laboratory diagnosis of ALL. So, similar to AML, the hemoglobin level will be reduced, RBC also be reduced, platelet reduced, and WBC counts will be high and mostly the lymphoid series. যদি peripheral blood film করি তাহলে দেখা যাবে RBC normocytic normochromic and sometimes the nucleated red cells are present in the RBC. But in the film predominant cells are the lymphoid cells and the lymphoid cells are mostly the lymphoblast. Platelet are reduced. So, in case of ALL special stain যেটা আগে বললাম একটা myeloperoxidase positive in case of AML and negative for ALL, but PAS is negative for AML and positive for ALL. So, again flow cytometry is also be done, cytogenetics PCR, but these are not commonly used in our country. So, our country is used lumbar puncture in all patient in ALL, but in AML only there is a neurological problems. তারপর এখন আমি যাব chronic myeloid leukemia. Chronic myeloid leukemia is another name is chronic granulocytic leukemia. Why this chronic myeloid leukemia occurs? Due to mutation of the myeloid stem cells, resultant proliferation of the mature neoplastic granulocytes and blast forms in the marrow, and also some normal cells are still present. So, a wide range of cells forms are present exist in chronic myeloid leukemia. So, all the cells will be found. You will find the myeloblast, you will find the myelocytes, metamyelocytes, even the neutrophil mature cells are also present. In 95% of the cases in chronic myeloid leukemia, there is a Philadelphia chromosome is present. What is Philadelphia chromosomes? Here it is the reciprocal translocations of 9 and 22 chromosomes resulting the PH1 Philadelphia chromosomes. Remaining 5% of the cases and juvenile chronic myeloid leukemia is negative for Philadelphia chromosomes. CML occurs between 30 to 60 years of age, peak which is 45 years. So, clinical presentation like the previously other leukemia, it is anemia. Here there is a splenomegaly, fatigue, weight loss. Other symptoms are sweating, night sweating especially, joint pains, bone pains and unexplained fevers. Chronic myeloid leukemia have a 3 phases: chronic phase, accelerated phase and blast crisis. ইতিমধ্যে তোমরা জানো যে blast crisis, if the chronic leukemia enters into the blast crisis phase, so the patient will in the end stage. But the chronic phase fairly is a stable phase and 2 to 5 years it is stable without any treatment. But this stage, but this year persists, if the treatment is going on, then more than up to 10 years it can be prolonged without any complaints. During this phase WBC count rises, but most cells are mature and function normally. Typical symptoms are fatigue, headache, pain, fullness. Fullness, why? There is a splenomegaly, that is why it is fullness. Accelerated phase, it lasts for 1 to 6 months. If the treatment is given, then accelerated phase may extends up to the 1 years. And if there is a blast crisis, that is blast cells begins to proliferate in large number and production of other cells including erythrocytes and platelets. So, the patient can experience bleeding and infections. During this phase the disease resembles the AML, and in most cases their life will be in the end stage. If chronic myeloid leukemia reaches to the blast crisis like the feature of AML, then he will be survive for a few minutes. Chronic lymphocytic leukemia is a predominantly middle age or older age group, but the common age is 45 to 75 years and maximum occurs at the age of 55 to 60 years. Chronic lymphocytic leukemia below 30 years is very rare. Male are affected twice as frequently as females. CLL is aggressive in some patients, but those cases are very aggressive, may survive up to 2 to 3 years, but usually most people's the CLL survival year is up to 10 years. But if adequate treatment is given, the survivability almost the normal people. So, the common features is the lymph node enlargements, anemia, and sometimes CLL patient is not diagnosed as complaint because they becomes asymptomatic. So, what happen? Routine checkup for any কি বলবো, a yearly routine checkup for officials or for insurance, then suddenly he found that he is suffering from the chronic lymphocytic leukemia. So, the patient is advised is so exhaustion you avoid, because these patients have a predisposition to infections, have a hemorrhagic manifestations, maybe hemolytic anemia, there is a joint or bone pain, disturbance in the hearing and visions, and lastly that they also have a tonsillar enlargements. Bone marrow spread, so what we found? Hypercellular marrow, myeloid erythroid ratio is altered, erythropoiesis is depressed, leukopoiesis is increased, megakaryopoiesis is increased, or in the later stage it is decreased, depressed. তারপর এখন আসা যাক the prognosis কিভাবে ডিপেন্ড করবে. Prognosis related to the stage of the chronic lymphocytic leukemia. If the stage 1, then prognosis life expectancy is more than 10 years. So, what have the characteristic? Peripheral blood lymphocytosis, so there is no other symptoms. If the peripheral blood lymphocytosis with lymphadenopathy, that is stage 2, so it is more than 8 years of survivability. But hepatosplenomegaly যদি থাকে তার সাথে, then the life expectancy becomes less than 7 years. And with anemia, so in case of chronic lymphocytic leukemia, always the 3 to 6 month interval there is the routine checkup. If there is a anemia, hemoglobin level decreased along with the lymphocytosis, lymphadenopathy and hematosplenopathy with anemia, then the life is within 2 to 5 years. And with thrombocytopenia is occurs along with them, then life will be less than 2 years. So, the chronic lymphocytic leukemia depends on the treatment, depends on the subtype of leukemia. Subtypes means the leukemia is a T cell variants or B cell variants. If it is a B cell variants, then what are the other B cell variants? That is chronic lymphocytic leukemia B cell origin. So, treatment is one group. B prolymphocytic leukemia, hairy cell leukemia or plasma cell leukemia, these are the B cell variants, treatment are almost similar. In case of T cell variants, CLL, the prolymphocytic leukemia, adult leukemia and large granulocytic T cell leukemia. The diagnosis, laboratory diagnosis of CLL against the CBC, that is complete blood picture of peripheral blood films and bone marrow aspirates. So, the complete blood picture is CBC, hemoglobin will be reduced, RBC count reduced, platelet count reduced, only the WBC count, especially the lymphocytosis. In case of peripheral blood film, RBC is normocytic normochromic, so no problem, is lies with the WBC series. It may be the normal or increased in number, monotonous lymphocytes with presence of few immature cells and plenty of smear cells are present in the peripheral blood fields. Then bone marrow aspirates, hypercellular, myeloid erythroid ratio is increased, erythropoiesis depressed, leukopoiesis is increased, especially in the lymphocytes, and precursor megakaryocytes also depressed. So, remaining flow cytometry আমাদের দেশে এখন হচ্ছে CD19, CD20, CD23, CD5 and lack of pan B cell marker other than CD5. Cytogenetics, তার সাথে দুইটা জিনিস খুব ইম্পর্টেন্ট, সেই দুইটা জিনিসকে লিকোময়েড রিঅ্যাকশনস। এইটা যদি তুমি পরীক্ষার হলে না বলতে পারো হোয়াট ইজ লিকোময়েড রিঅ্যাকশনস, তাহলে এক্সামিনার অত্যন্ত মাইন্ড করবে। সো লিকোময়েড রিঅ্যাকশন কি জিনিস? গুড, the peripheral blood picture resembles that of the leukemia, but actually the patient not suffering from leukemia. So how you will diagnose the case? They only the answer the by bone marrow examinations. In bone marrow examination what happened? Bone marrow examination হচ্ছে যে কি, the bone marrow is like the normal blood, normal persons, not the leukemia persons. In leukemia, bone marrow is flooded with the immature cells, but in leukomoid reaction, bone marrow having the normal blood cells or normal environments. Only the peripheral blood picture shows the leukocytosis. It is of leukomoid reaction two types, myeloid leukomoid reactions and lymphoid leukomoid reactions. So, subleukemic, the peripheral blood picture looks like a normal, but the patient is suffering from leukemia. Just myeloid, that leukomoid reaction is just ulta. Leukomoid reaction তোমরা পেয়েছো কি, যে peripheral blood picture seems to be or resembles to be a leukemia, but the bone marrow actually the patient do not have the leukemia. But in case of subleukemic leukemia, what happened? The peripheral blood picture seems to be normal, but the bone marrow examination shows it is a leukemia. So, why this impression comes? The peripheral blood picture, the total counts is normal or even subnormal, but containing few immature cells in the peripheral blood. তারপরে দেখা গেল কি, bone marrow করতে গেলে bone marrow is flooded with the immature cell. So, it is a leukemia, subleukemic leukemia, it is a one type of leukemia, but leukomoid reaction is not a leukemia. And another term is important, leukoerythroblastic blood pictures. So, peripheral blood picture shows leuko, that means immature WBC series, erythroblastic, that is immature red cells. So, both if we find the immature leukocytes and immature red cells, that is nucleated red cells normally not present in the peripheral blood. If we find the nucleated red cells in the peripheral blood, what happens? So, we have be cautious, the patients may have a carcinoma. The patients, the cause হচ্ছে কেন পাচ্ছি আমি, the patient have suffering from a carcinoma bone, the patient having myelofibrosis, the patient having thalassemia major especially after splenectomy, অথবা multiple myeloma অথবা lymphoma. So, a key feature is the presence of numerous nucleated red cells, that is 10 or more than per 100 WBC, and increase in the reticulocyte count 3 to 10%, and appearance of the metamyelocytes. তাহলে today this is about the leukemia. Now, from next class your class will be the myelodysplastic disorder, and then pathophysiology of myelodysplastic disorder, how you will diagnose a myelodysplastic disorder, and what are the difference between myeloproliferative disorder to myelodysplastic disorder. So, from next class you will find, and thank you to you all.